good afternoon, good morning, and good evening to everyone that's listening to us across the globe. And this evening, our conversation is just around how the OGP process has been advancing the healthcare systems in Nigeria. And it's important to note that right now we have the National Action Plans, which is running from 2019 to 2022. Basically, which also divided the whole action plans into 7 thematic areas. And it's important to note that the healthcare or the Ministry of Health was divided under the service delivery, which is basically trying to understand how the government is ensuring that the citizens of Nigeria are getting the best when it comes to healthcare delivery systems across the country. And we've done a lot of research. We've done a lot of work around trying to understand how much the government has invested into health. And we've presented a lot of publications, also deep diving into how much resources the government has committed to health, right? And just yesterday, I was speaking to our partners trying to understand what's the most expensive investment the government has put into health across our countries, right? And it's important to note that just yesterday, President Muhammadu Buhari signed into law a new insurance policy, which would also cater for Nigerians who are not able to pay for their premiums across the country. And this ushers us into a new regime where we are able to get donations to cater for the premiums of Nigerian citizens. But there are still some things that we still need clarity for in that signed law. Where the donations are coming from, we are not able to get that yet. But I believe that with more analysis and probing this new law, we are able to get where that is from. And now looking at what COVID-19 is all about in Nigeria, right? The CTAP project is running for the second phase. And we started with 7 countries, and we're now across 9 countries across the globe, across the African continent, right? And we have been able to, record some substantial successes, right, across our African countries. But looking at Nigeria, when the heat of COVID started, we sought out to understand how funds were being spent. We sought out to understand how the old COVID funds coming into the country, how they were being managed, right? And we started with platforms trying to understand and trying to keep records of how these funds were coming in, right? And it came to a point where we needed to also now start to understand how these funds were being spent. Right, we made a lot of noise around it, and that was when the Nokopo platform released a portal for COVID-19 funds. Right, the Nokopo platform is the National Open Treasury platform, which was instituted by the Nigerian government, and this helped us to understand how much funds were being released and to who these funds were being released. And we probed some of these funds because we wanted to understand if value of money were being achieved by these funds that were being spent, and also to understand how procurement were done, and also the process of this procurement, the procurement period. How was it established? Who were the ones involved in the procurement process? All of these things were things we probed, and till now, the National Action Plans running has given the government till June 2022 to be able to give more details into how much was spent during COVID, also release audited statement, because till now, as I speak to you, the federal government of Nigeria has not been able to release to the public how much the presidential task force spent during the heat of the pandemic, right? We've done a lot of engagements. We've met with stakeholders. We've met with audit partners, and also we've been able to gather coalitions. Also asking the same questions, which is how much was spent. Who was it spent for? What was it spent on? The Open Treasury platform also gives us the window of opportunity to understand how much was spent, and also who were the beneficiaries of these funds, right? But at some point, the platform was down, and at some point when we did our analysis, some information on the platform were changed. right? And this, there's a weaving dissonance in that space, which is either some information are being hidden from us, from the public, and also either they don't want us to, get access to some of the information that we want to know. But in the long run, what we've done is to, make sure that citizens understand how much, how much has been spent, as towards COVID-19 funds in Nigeria, right? And also, it's important to note that they have been able to look across the country, the primary healthcare systems, because if you look at vaccine distribution and the primary healthcare system, there's a connection in that space, and this is because across the country, the vaccines has been distributed through the primary healthcare centers across Nigeria. But there's a problem, and the problem is the state at which these primary healthcare centers are very deplorable, and we've made a lot of noise around it and trying to see how we can, increase the investment that goes into the primary healthcare centers and make sure that they are up to standard. We did a little bit of work around understanding how much, the government is providing for each Nigerian on the federal government level, and we realized that for every citizen, you are being provided for with a sum of 3,000 naira, right? And that's really low in the scale of things. And we hope that the new law signed by the president is going to take that up a little bit and make sure that Nigerian citizens are able to, benefit from the best healthcare systems around. And it's also important to note that civil society and the government are working to, institutionalize the national action plans that we have, and also see how fast we can, make sure to achieve these national action plans before the present national action plan ends. Because we already what we see as a window of opportunity for the next national action plan is to see how we can, put in health sector accountability into play, because we have a window of opportunity in Nigeria now, because the new national action plans are being prepared, and we want to see how we just don't put the health sector under one of the sections. We want to see how it also becomes a commitment on its own, right? Because we believe that if it becomes a commitment on its own, then the civil society involved and the government are able to put in more priority to make sure that the national action plans for health are being institutionalized across the country. Then also looking at the OGP and the civil society organizations and the CTAP project itself, what we intend to achieve is across all our 9 countries that we are rolling. We understand that some of our countries do not have OGP, in the countries at the moment. And we also understand that some of the countries have OGPs in the country at the moment. We want to see a situation where all of our countries in their new national action plans, and if it's possible to ratify some of the national action plans that have been passed, a health sector accountability, as a priority, because we believe that health is important, and we need to prepare for medical emergencies in the near future. We have seen Ebola, we have seen COVID, right? And we do not know what is coming next, but we pray that we are able to prepare ourselves as, African countries, and also make sure that we are able to provide a safety net for every citizens of our countries. And we believe that the CTAP project is going to put us a step forward, where we are able to, institutionalize health sector accountability across our countries. Thank you very much.